Welcome, everyone, to the 2025 Annual Report for the Client Consumer Population, brought to you by Access California, a program of CalVoices. Introduction. In this section, we will talk about the history of Access California, its relationship to CalVoices and the Commission for Behavioral Health, and the overall goals, objectives, and activities of the Access California program in 2025. Access California, or Access for short, is a program of CalVoices that is funded by the Mental Health Services Act through a contract administered by the Commission for Behavioral Health, formerly known as the Mental Health Services Oversight and Accountability Commission, or MHS-OAC. Access California is a program of CalVoices. In 1946, a coalition of mental health patients, service providers, and interested community members began a local mental health association chapter in Sacramento, which is now known as CalVoices, one of the oldest continuously operated client-run advocacy organization in California. CalVoices is an affiliate of Mental Health America, or MHA, the country's oldest and largest nonprofit organization addressing all aspects of mental health. For nearly 80 years, CalVoices has provided behavioral health clients with culturally affirming peer support services, assistance in navigating various human service agencies, and advocacy for a client-oriented public behavioral health policies. Currently, CalVoices operates peer support programs in Amador, Placer, and Sacramento counties and provides training, education, technical assistance, and advocacy for peers, clients, providers, counties, and other agencies across the state. Over 98% of our staff identify as clients, family members, or both, including our entire executive leadership team and all of our program managers. More than 95% of our employees work in designated peer positions. These positions require personal lived experience of recovery from a behavioral health challenge and/or personal lived experience as a family member of a child, youth, or adult with a serious behavioral health condition as a minimum qualification for employment. CalVoices' mission is to represent the self-identified needs and priorities of clients and consumers in the public behavioral health system through culturally relevant and recovery-focused advocacy, outreach, education, and peer support. For nearly 3 decades, CalVoices has employed advocates embedded in county mental health systems to promote change from within and has advanced individual empowerment and self-advocacy for mental health consumers through the direct provision of peer support services rooted in the recovery model of care. In 2004, CalVoices strongly advocated on behalf of Prop 63, investing hundreds of staff and volunteer hours to promote the passage of the landmark Mental Health Services Act initiative. In all of our activities, we seek to elevate the voices of consumers receiving public behavioral health services. Our dedicated staff of over 60 employees and 100 volunteers thoroughly reflect the cultural communities and populations we serve. CalVoices programs address the behavioral health needs of consumers and family members across the lifespan, from children and transition-age youth to adults, parents and caregivers, and older adults. And all of these age groups are well represented in our diverse network of employees and volunteers. CalVoices is well-versed in the recovery model, community inclusiveness, and stakeholder engagement principles, and peer employment issues as they relate to services, processes, and practices within the public behavioral health system. In all of its 13 peer-run programs, CalVoices wholeheartedly strives to implement the Mental Health Services Act general standards, including community collaboration, cultural competence, client-driven services, wellness and recovery focus, and integrated services experiences for clients and their families. Access California is funded by California's Mental Health Services Act. The Mental Health Services Act, also known as Prop 63 or the MHSA, was a grassroots-led ballot initiative that California voters passed in November 2004. It imposed a 1% tax on all personal income over $1 million to pay for mental health services and supports not covered by Medi-Cal, California's state Medicaid system. It aimed to transform California's public mental health system from a fail-first model to a help-first model by providing whatever it takes to help people with severe mental illness get well and stay well. The Mental Health Services Act had 5 general standards for all programs and activities funded by the Act. 1. Community collaboration. 2. Cultural competence. 3. Client-driven adult services and systems of care, and family-driven children's services and systems of care. 4. Wellness, recovery, and resilience focus. And 5. Integrated services experiences for clients and their families. In 2023, California's legislature sought to overhaul the MHSA to use its revenues to address the state's growing unhoused crisis. To accomplish this, the legislature placed Proposition 1 on the March 2024 primary ballot, which voters approved by 50.18%. Prop 1 did all of the following. It renamed the Mental Health Services Act of 2004 to the Behavioral Health Services Act and expanded its purpose to include substance use disorders, including for persons without a mental illness. It changed how revenue from the 1% tax on income above $1 million is spent under the law, including requiring 30% of the Behavioral Health Services Fund to be allocated to housing intervention programs. It increased the size of the Oversight Commission, or the Commission for Behavioral Health, from 16 to 27 voting members, and it issued $6.38 billion in bonds to fund housing for unhoused individuals and veterans, including up to $4.4 billion for mental health care and drug or alcohol treatment facilities, and $2 billion for housing for unhoused persons. These housing interventions include locked facilities. Access California is funded by a contract administered by the Commission for Behavioral Health, formerly known as the Mental Health Services Oversight and Accountability Commission, or MHS-OAC. Proposition 3, or the MHSA, approved by California voters in 2004, created the Mental Health Services Oversight and Accountability Commission to drive transformational change across the state's mental health system. The commission oversees the implementation of the far-reaching initiative, which imposed a 1% income tax on wealthy residents to pay for mental health services and established a framework for continuous improvement of mental health care in the state. Partnering with public and private mental health agencies at all levels, the commission works to ensure that people get the care they need in a timely, comprehensive, effective, and culturally competent manner. In everything, it vigorously promotes community collaboration. The Commission's primary function is to oversee the implementation of the Mental Health Services Act and now key aspects of the Behavioral Health Services Act. The Commission distributes grants, collects and shares spending and efficacy data on local programs, spreads best practices, conducts research into critical subject areas like criminal justice involvement of people with mental health needs, and engages experts to develop policy proposals and other path-breaking solutions. The Commission advises the governor and legislature on mental health policy. In addition, lawmakers have periodically given the Commission new responsibilities, including distributing grants to expand mental health services in schools, helping develop voluntary standards to support mental health in the workplace, and helping to build a statewide suicide prevention plan. CalVoice's partnership with the Mental Health Services Oversight and Accountability Commission, now the Commission for Behavioral Health, began in 2017. We are grateful for the Commission's ongoing support and encouragement and its dedication to improving the lives of behavioral health clients throughout California. Launched in 2017, Access California is CalVoice's statewide, client-run behavioral health advocacy program. Its mission is to strengthen and expand client participation in local and state-level advocacy and build knowledge and skills that expand individual and community empowerment. Through Access California's ongoing research, data collection and evaluation, policy analysis, advocacy, education, training, outreach, and engagement activities, it implements strategies to elevate the voices, identify the needs, and increase genuine public participation of client stakeholders to drive truly transformative change in California's public behavioral health system. Access California works with local advocates and organizations throughout the state to provide training, technical assistance, and support to county behavioral health agencies, clients, and other stakeholders to strengthen community collaboration and client involvement in local behavioral health planning and decision-making. Access California also works directly with state behavioral health agencies and the California legislature to represent the client voice in discussions regarding important issues and promote policies that meet the needs of clients receiving and or eligible for public behavioral health services. Who we are. Access California is staffed and supported by the following individuals. Danielle Zavala is Cal Voice's Associate Director and General Counsel. She is a licensed attorney and has lived experience of recovery from several behavioral health conditions. Since joining Cal Voices in 2012, she co-founded the agency's Workforce Integration, Support, and Education, or WISE program, in 2015, and founded the Access California statewide advocacy program in 2017. For the past decade, Danielle has served as an educator and subject matter expert in peer employment and behavioral health advocacy. Danielle earned her Juris Doctorate degree from the UC Berkeley School of Law and was admitted to the State Bar of California in 2007. Claire Courtwright is Cal Voice's Advocacy Director. She is also a licensed attorney and peer with lived experience of serious mental illness. She has represented mental health clients in the involuntary system and provided peer support in a variety of settings. She currently manages Cal Voice's Access California program, where she monitors and educates community members about state-level mental health policy. Claire is passionate about fundamental change for persons living with mental illness and other behavioral health conditions. She earned her Juris Doctorate degree from the UC Hastings College of Law and was admitted to the State Bar of California in 2014. Jocelyn Farrell is Access California's program coordinator. She is driven by her personal experiences with recovery and is passionate about dismantling the stigma around mental illness, promoting the worth and dignity of all individuals, and empowering others to pursue healing and wholeness. She has worked in nonprofit human services for several years and formerly taught high school Spanish. Nicole Chilton manages Cal Voice's Hear Us Recovery Education Program and is the program director of the California Association of Peer Professionals, another program of Cal Voices. She has a passion for advocacy, prevention, mentorship, and has worked in social services since 2013. Nicole believes in the power of hope in recovery and uses her lived experience to meet everyone where they're at. Grace Gallagher is a program coordinator for Cal Voice's Hear Us project and CAP program. With almost 5 years of working for Cal Voices in various roles, she uses her lived experience as a consumer and family member to foster meaningful connections within the behavioral health community. What we do. The word access in Access California stands for Advancing Client and Community Empowerment through Sustainable Solutions. Access envisions a California public behavioral health system in which high-quality, voluntary behavioral health services are readily available to those in need and are designed and implemented to provide clients with the tools and resources they require to achieve lasting recovery. To actualize this vision, Access focuses on achieving the following outcomes. 1. System transformation and evolution. 2. Meaningful stakeholder involvement. 3. Recovery-oriented systems of care. And 4. Consumer-operated services and peer support. System transformation and evolution. Access strives to preserve, protect, defend, and expand the overall transformative vision and core values of the Mental Health Services Act in all aspects of state and local behavioral health policies, program planning and implementation, monitoring, quality improvement, and budget allocations. These values include community collaboration, cultural competence, client-driven adult systems of care, family-driven children's systems of care, wellness, recovery, and resilience focus, and integrated services experiences for clients and their families. Access advocates at the state and local levels for policies that uphold these values to ensure the public behavioral health system remains responsive to the individuals it serves. This transformative vision includes systems and services that innovate and regularly update their approaches to better meet clients' needs, invest in prevention efforts to keep children, adults, and seniors well, and focus on whole person care by incorporating non-behavioral health supports that enhance individual wellness and recovery. Such systems and services also measure, track, and analyze key data points to assess their progress and make data-driven decisions to continuously improve and evolve. Meaningful stakeholder involvement. Access seeks to strengthen and expand opportunities for meaningful client and peer involvement in all aspects of state and local behavioral health policies, program planning and implementation, monitoring, quality improvement, and budget allocations. This includes system-wide responsibility to actively engage, educate, and fully inform clients and peers so they can effectively participate in policy planning and development through an effective and inclusive community program planning process. As recent legislation and state-level policies have diluted the client voice, now more than ever, Access must remain a steadfast advocate for the ongoing inclusion of clients at all levels of behavioral health decision-making, working to expand stakeholder input and involvement, and continuing to educate and support clients, peers, and allies in their efforts to advocate for their own needs, priorities, preferences, and interests at the state and local levels. Recovery-oriented systems of care. According to the Federal Substance Abuse and Mental Health Services Administration, or SAMHSA, recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. There are 4 major dimensions that support a life in recovery: health, home, purpose, and community. Recovery is how individuals with significant behavioral health challenges get and stay well and maintain their personal independence and autonomy. The public behavioral health system must function in all ways to uplift and heal clients, rather than relying on outdated fail-first approaches that merely diagnose, medicate, monitor, and warehouse them. Planning for services must be consistent with the philosophy, principles, and practices of the recovery vision for mental health consumers, to promote concepts key to the recovery of individuals who have mental illness: hope, personal empowerment, respect, social connections, self-responsibility, and self-determination; to promote consumer-operated services as a way to support recovery; to reflect the cultural, ethnic, and racial diversity of mental health consumers, and to plan for each consumer's individual needs. To accomplish this, the public behavioral health system must implement recovery-based data collection, along with performance-based contracting approaches that are specifically focused on recovery outcomes, clients' quality of life, and social drivers of health. Consumer-operated services and peer support. According to SAMHSA, consumer-operated services is an evidence-based practice that has consistently demonstrated effectiveness in helping people with mental illnesses achieve their desired goals. Such services may be called by other names, such as consumer-operated service programs, consumer-run organizations, peer support programs, peer services, or peer service agencies, and they may also function as wellness centers, drop-in centers, or clubhouses. Consumer-operated services, including peer support services, have been recognized as evidence-based practices by the Centers for Medicare and Medicaid Services since at least 2007, and by SAMHSA since at least 2009. Per SAMHSA, consumer-operated services are peer-run service programs that are owned, administratively controlled, and operated by mental health consumers, and emphasize self-help as their operational approach. While consumer-operated services frequently collaborate with other providers, they remain fully autonomous and retain an identity distinct from their collaborative partners. Specifically, to be consumer-operated and thus maintain fidelity to the evidence-based practice model, such services must meet 5 criteria. 1. Independent. The entity is administratively controlled and operated by mental health consumers. 2. Autonomous. Decisions about governance, Fiscal, personnel, policy, and operational issues are made by the program. 3. Accountable. Responsibility for decisions rests within the program. 4. Consumer controlled. The governance of the board is at least 51% mental health consumers. And 5. Peer workers. Staff and management are individuals who have received mental health services. Recent legislative changes and state-level policies in California threaten existing consumer-operated services and peer support programs currently funded by the Mental Health Services Act as part of the state's effort to move away from the MHSA's recovery vision in favor of more involuntary interventions. This is at a time when California's employment rate for public behavioral health clients is consistently far below the national average, ranging at around 10 to 12%, while the rate for the entire country is over twice that. CalVoices Access California and California Association of Peer Professionals programs collaborate to strengthen the peer profession and expand access to high-quality behavioral health peer supports and consumer-operated services by advocating for policies that benefit peers, including fair wages, benefits, and working conditions, professional development and career advancement opportunities, and the inclusion of peer representation at all levels of state and local behavioral health planning and decision-making. Together, Access and CAP provide peer networking and collaborative opportunities, training and technical assistance to peers and their employers, foster public understanding and appreciation of the peer profession, and promote best practices in the delivery of peer support services. To accomplish its vision, Access utilizes strategies specifically tailored for clients and behavioral health leadership. These strategies have been honed over Access's years of advocacy, education, and coalition building experience. Client-focused strategies include treating clients as necessary and valued participants in public behavioral health planning and decision-making activities, educating clients about their rights to services and public participation under the Mental Health Services Act, Behavioral Health Services Act, and other relevant laws, empowering clients with the knowledge and skills they need to become capable public advocates, modeling effective public advocacy techniques to help clients promote stigma reduction and foster greater appreciation for client involvement, assisting clients in identifying opportunities, strategies, and access points for local and state-level advocacy, informing clients about important mental health legislation and policy issues impacting them, providing clients with key facts, findings, and policy recommendations, and talking points to help them develop advocacy strategies and craft impactful public statements, connecting clients with networks of like-minded individuals and entities with whom they can collaborate to achieve local and statewide advocacy objectives, educating, engaging, and informing peers and consumer-run agencies and programs about issues and policy trends affecting their livelihoods, and collectively advocating for policies and approaches that elevate and adequately fund these services, and supporting clients' individual and collective efforts to create positive change in the public behavioral health system. Access also employs leadership-focused strategies to accomplish its vision. These strategies include fostering deeper understanding of behavioral health funding sources, programming mandates, statutory and regulatory requirements, and other laws governing public behavioral health system advocacy, services, and outcomes. Educating leaders about the philosophical and evidentiary foundations of recovery-based care and the importance of collecting, analyzing, and utilizing recovery outcomes data to improve service efficacy and client experiences. Supporting state and local leaders' efforts to engage clients in public behavioral health planning and decision-making activities. Demonstrating effective public advocacy skills to reduce stigma and foster greater appreciation for client involvement. Providing leaders with practical guidance, recommendations, and best practices to expand client inclusion and participation, peer support and recovery-oriented services, utilization of recovery outcomes, systems transparency, and public accountability. Promoting adequate funding for peer support programs and consumer-operated services as cost-effective, evidence-based practices and a way to tackle the state's astronomical consumer unemployment rate. And assessing and monitoring state and local adherence to Mental Health Services Act and now Behavioral Health Services Act mandates, and other laws governing public behavioral health advocacy services and outcomes. Major behavioral health policy issues for the 2024 to 2025 contract year. Clients in California's public behavioral health system are facing unprecedented challenges to meaningful advocacy and involvement in behavioral health policy decisions. These challenges stem from sweeping legislative changes and massive shifts to statewide policy priorities that are upending how the system has operated for the past 2 decades, impacting everything from who receives services, how and where services are accessed, and the nature and focus of these services, who delivers them, and the long-term outcome service recipients can expect to achieve. This paradigm shift does not result from new advancements or understandings in the fields of psychiatry, psychology, addiction medicine, wellness, or recovery. Rather, it arises from visibly worsening social conditions throughout the state, which have accelerated over the past half-decade. Policymakers and average citizens alike often attribute rising homelessness and crime to untreated mental illness and substance use disorders. While these issues are often correlated, causation is much more complex and nuanced. Thus, effective policy solutions must focus on the directions in which these conditions influence one another and address the common factors at the roots of these problems. Merely treating the visible societal symptoms of these issues is insufficient to truly remedy them and prevent them from recurring over time. Unfortunately, nuance, complexity, and long-term solutions to entrenched problems that are negatively impacting everyday Californians' sense of safety and quality of life tend to be politically unpopular and/or take years and dedicated effort to implement, which is how we end up with flashy but fatally flawed policies. Think, 3 strikes, you're out. It appears the state's current behavioral health policymakers may be falling into this trap. In recent years, the legislature and governor's administration have shifted away from the recovery vision set forth in the Mental Health Services Act and have begun to prioritize obsolete models of care that are professionally driven rather than client-driven, illness-focused rather than person-focused, and deficits-based rather than strengths-based. These policymakers are now focusing their efforts on expanding coercive and involuntary treatment approaches purportedly aimed at addressing the state's rising unhoused population. Although numerous studies show the worsening homeless crisis is a direct result of the state's outdated economic policies and lack of affordable housing for low-income individuals, particularly seniors and those with disabilities, lawmakers have thus far eschewed effective upstream interventions in favor of passing increasingly draconian laws that primarily target the poor and disabled. Such new laws include those requiring counties to opt out instead of opt in to assisted outpatient treatment programs, creating a brand new court system that uses the threat of conservatorship to encourage clients to engage in treatment, and expanding conservatorship criteria to include people who lack sufficient resources to meet their basic needs. The legislature rewrote the entire Mental Health Services Act to shift funding away from voluntary prevention-based programs and recovery-oriented care to prioritize involuntary interventions. Proposition 1 is a mechanism through which voters approve the legislature's sweeping changes to the Mental Health Services Act. Access California has focused on how the state is implementing Proposition 1 at the state and local levels, and advocating for rules and regulations to preserve recovery-oriented programs and consumer-operated services wherever possible. To address these emerging policy issues and harness the opportunities they present, Access California incorporates the following 8 activities and events into its overall advocacy strategy. 1. We convene a robust statewide coalition of local-level entities, allied community-based organizations, grassroots advocates, and peer professionals working together to identify and elevate the behavioral health needs of clients to the California legislature, state administrative agencies, and other state and local decision makers. 2. We monitor pending legislation and statewide policy issues and analyze their impacts on public behavioral health services, clients, recovery-based programming, peer-run and consumer-operated agencies and programs, and peer support professionals throughout the state. 3. We participate in legislative hearings and state agency meetings, working directly with lawmakers and their staffs and fostering partnerships with leaders at the state and local agencies to inform and influence policy decisions. In particular, we focus on the impacts of Proposition 1 and other efforts to modernize the public behavioral health system to shape and inform the implementation of legislative changes, representing client and peer interests and elevating stakeholder voices. 4, we conduct ongoing research and data collection regarding social determinants of health, psychosocial risk and protective factors, and barriers and challenges to client engagement and participation in services that impact long-term recovery outcomes and both individual and community wellness. 5, we develop content, materials, and communications to educate and inform clients and consumers and allies about pending policy changes, their potential impacts, and ways to make their voices heard, and state and local decision makers about client needs and preferences, greater client inclusion in policy development and decision-making at the state and local levels, and best practices in the design and delivery of behavioral health services. 6, we cultivate an informed and engaged cohort of client subject matter experts to provide their voices and perspectives on state-level policy issues. We connect these subject matter experts with opportunities to participate in state-level advocacy activities and encourage them to serve on state and local decision-making boards, committees, commissions, and advisory bodies. 7, we host an annual statewide advocacy event for clients that is also attended by lawmakers, leaders of administrative agencies, counties, members of decision-making bodies, and other advocacy agencies to facilitate networking and information sharing, promote client voice to decision makers, and advance specific policy positions and recommendations. And finally, 8, we publish this annual report that communicates and highlights the voices and experience of clients and effectively informs state decision makers on critical behavioral health needs. Throughout this annual report, members of the Access California team will discuss major activities conducted throughout the 2024-2025 contract year, along with key outcomes, challenges and barriers, and lessons learned. The following sections of this report will discuss activities we conducted in contract year 1, including state-level advocacy activities, local-level advocacy activities, training and education activities, and outreach and engagement activities. The Access program has a state-level advocacy component, and that has actually been essential this year because while the ultimate goal of the program is to empower advocacy at the local level, we're just in a unique time when state-level policy decisions are entirely about how counties must or should operate the public behavioral health system at the county level. And so this essential work this year inside Access has looked like keeping abreast of really significant policy changes, legislative bills, regulations from the state, budgetary issues, and even things going on at the federal level. And the program has kept up to date, analyzed these changes for their actual impact, simplified that information, taught it to the stakeholders, got the stakeholders' goals and desires with respect to what is happening, and then Access has taken that back up to the state level, to state-level policymakers. And this work has involved also policy updates. So there are regular trainings and vehicles that we do to share information and gather feedback. And we'll give a little more explanation of what those are. The Access program this year has translated complicated and lengthy policies for the core stakeholders of the public behavioral health system, persons with serious mental illness or substance use disorder, and communicated stakeholder demands to state-level policymakers as the largest law and policy changes in 60 years enter implementation phase. In addition, Access tracks new relevant bills that are continually being introduced in the legislature. As client consumers and peer providers in California's public behavioral health system, the most impactful change is the transition from the Mental Health Services Act to the Behavioral Health Services Act under Proposition 1. The Mental Health Services Act to Behavioral Health Services Act transition process has been a major focus of the grant this year as stakeholders look to understand how their services may change, jobs may change, and to get prepared for the first community planning process under the Behavioral Health Services Act. Access initiated a new annual survey of the peer workforce that shows many peers are not Medi-Cal certified and are working in consumer-operated, peer-operated models of care like wellness and recovery centers. These are most threatened by the Behavioral Health Services Act funding shifts. Access responded to the stakeholder need for information and analysis specific to the frontline impacts. Will my wellness center close? It's the only resource in our rural community. Will I still be eligible for housing? What's happening with peer support? Will my loved one lose their full-service partnership? These questions would mostly be answered by the new regulations to the Behavioral Health Services Act. The Access program met the community stakeholder need for technical assistance and technical expertise and drafted proposed regulations to the BHSA on behalf of the community. This included asking that funding for consumer-operated, community-based organizations be preserved and prioritized on behalf of nearly 24 such entities. Access also sought a grandfathering provision to ensure that those currently housed through the Mental Health Services Act would not lose their housing under the Behavioral Health Services Act when eligibility criteria and allowable settings narrowed. We were successful, and the final regulations to BHSA housing interventions includes the grandfathering clause that will ensure those currently housed through MHSA continue to have a housing subsidy without redetermination on an ongoing basis. Knowledge is power. A key lesson from the state-level advocacy work this year has been how important it is to create opportunities for people with behavioral health conditions for us to get together in forums that are respectful of the tremendous lived experience and lived expertise, creativity, and intelligence in the community. We know it's up to us to ensure that our needs, as described by us, will be met by the systems meant to serve us. And I know we've created respectful and inclusive forums that add value when members of our community, many of whom perform uncompensated and too often unacknowledged but important work, tell us how we're helping them to water the seeds that they've planted. In the next grant year, we hope to let the community lead even more as the uncertainties in law and policy settle into more certain rules and advocacy has clear pathways. The primary goal of our local level advocacy activities is to amplify the client population's influence in local level decisions, policies, and programs in order to shape a public behavioral health system in which voluntary, high-quality services are readily available to those in need and are designed to provide a client with tools and resources to achieve lasting recovery. To accomplish this goal, we brought together 12 local level entities from throughout the state. In the Superior region, we partnered with the Hmong Cultural Center of Butte County and Sunrays of Hope in Modoc County. Hmong Cultural Center of Butte County was founded in 2000 as a nonprofit 501c3 organization. Its mission is to improve the lives of individuals and families through culturally sensitive education, advocacy, support, and services. HCCBC strives to preserve essential Hmong beliefs and restore acceptable cultural practices and values. It provides resources, community-based family support, and empowerment through the promotion of health, education, cultural integration, and social services to strengthen Hmong families and communities throughout Butte County. Sunrays of Hope is fully committed to empowering its peers and community through education and support that is needed to gain overall wellness. Sunrays of Hope strives to provide the best accessible and acceptable county population services, including culturally and age-appropriate material to maximize wellness and recovery. In partnership with local community agencies through a contractual agreement with Modoc County Behavioral Health, Sunrays of Hope provides peer and community support, referrals, training, activities, and socialization. In the Bay Area region, we partnered with the Law Foundation of Silicon Valley and Silicon Valley Debug. The Law Foundation was established nearly 50 years ago and uses innovative legal advocacy as a tool for social change. They work tirelessly to ensure that every person in their thriving region is granted the same rights and legal access. Every day, their attorneys, social workers, and advocates craft inventive solutions to the life-changing legal issues that are facing low-income people in Silicon Valley. The Law Foundation's mission is to advance the rights of underrepresented individuals and family in its diverse community through legal services, strategic advocacy, and educational outreach. Silicon Valley Debug is a community organizing, advocacy, and multimedia storytelling organization based out of San Jose. Since its inception in 2001, Debug has been a platform for Silicon Valley's diverse communities to impact the political, cultural, and social landscape of the region, while also becoming a nationally recognized model for community-based justice work. In the Central region, we partnered with Peer Recovery Services of San Joaquin County and Sustainable Wellness Solutions in Sacramento County. Peer Recovery Services of San Joaquin County proudly operates 3 wellness centers in Stockton, Lodi, and Manteca. Peer Recovery Services is a peer-run organization that offers free mental health and substance use support services, as well as mental health education for our community to promote wellness and recovery and reduce stigma surrounding mental health. Sustainable Wellness Solutions, established in 1989 as Consumer Self-Help Center, believes that healing occurs through relationships with other human beings, through connection. No one recovers alone. This is why they practice peer support. Peer relationships are effective. Today, Sustainable Wellness Solution offers several programs with skilled and experienced staff who know how to create these relationships. What many people call mental illness can be overcome. We have seen it. We have lived it. In the Southern region, we partnered with Communities Voices in San Diego County, Peer Professionals of California in San Diego County, and Peer Voices United in Orange County. Community Voices is a nonprofit corporation founded and run by female BIPOC peers. Founded in 2022 during the height of the COVID pandemic, its mission is to provide emotional support, non-hierarchical counseling services, and community services navigation, and also to build a network of community organizations throughout the state of California to facilitate connections with the public. It offers peer counseling, weekly support groups, collaboration, and navigation services. Peer Professionals of California is a 501c3 nonprofit, community-based organization that provides services to communities in need. Its services address the justice-involved, peer support, and community health needs throughout San Diego County. By advocating for the rights, well-being, and potential of aging and disabled inmates, as well as high-profile inmates, it strives to create a correctional environment that fosters growth, understanding, and second chances. Programs include justice-involved reentry services, peer support services, and community health worker services. Peer Voices United of Orange County is a collaborative initiative powered by Peer Voices of Orange County and 10 behavioral health provider partner organizations. Together, they work to empower individuals navigating challenges such as homelessness, unemployment, trauma, mental health conditions, substance use disorders, incarceration, and community reentry. Its mission is to create a movement that unites diverse voices within the behavioral health care community, expanding the reach and enhancing the quality of services for those who are most in need of them. Finally, in the Los Angeles region, we partnered with Los Angeles Community Action Network, Mental Health Advocacy Services, and Painted Brain. The mission of the Los Angeles Community Action Network, also called LACAN, is to help people dealing with poverty create and discover opportunities while serving as a vehicle to ensure that they have voice, power, and opinion in the decisions that are directly affecting them. Its vision is to organize and empower community residents to work collectively to change the relationships of power that are affecting their community, to eradicate the race, class, and gender barriers that are used to prevent communities from building true power, and to eliminate the multiple forms of violence used against and within their community to maintain the status quo. Mental Health Advocacy Services, MHAS, was founded in 1977 to provide free legal services to people with mental health disabilities. For more than 45 years, MHAS has helped low-income adults and children fight housing discrimination, obtain access to the rights and benefits to which they are legally entitled, and remove other legal barriers that impact their overall health and well-being. MHAS's mission is to protect and advance the legal rights of low-income adults and children with mental health disabilities, and to empower them to assert those rights in order to maximize their autonomy, achieve equity, and secure the resources they need to thrive. Painted Brain was initially founded in 2005 as a community-based art group at a mental health center in Los Angeles. It was formally incorporated as a 501c3 in 2016, and in 2017 opened its first drop-in community center in Los Angeles to provide its members with a safe, judgment-free space off the street, bringing actors, artists, writers, yoga instructors, mental health advocates, and more to lead activities and classes on the arts, life skills, and professional revision. Painted Brain's mission is to create lasting, community-based solutions to mental health challenges and the impacts of social injustice through arts, advocacy, and enterprise. Bringing together such a diverse group of organizations meant that each LLE came in with varying levels of advocacy knowledge and subject matter expertise, challenging us to offer robust training and support throughout year one of the program. This diversity also meant that each agency brought in their own valuable areas of passion and expertise, whether that be in housing, legal services, cultural identity preservation, or peer support services. Our goal in partnering together was to empower each other to be effective advocates within our own unique spheres of influence, united by our common vision of a voluntary, recovery-oriented public behavioral health system, and influencing change in ways that are only possible through collaboration. Our LLEs completed a total of 35 local-level advocacy activities throughout the year. LLEs spoke at county advisory board meetings, county behavioral health department meetings, and local coalitions, committees, and task forces, advocating for increased funding for peer support, the continuation and/or expansion of consumer-operated services, and for peers to be involved in local-level decision-making. In addition, our LLEs provided education to clients and peers about how to actively participate in their county's local community planning process, engaged in participatory defense to advocate for the rights of individuals experiencing mental illness within the court systems, provided voluntariness trainings to residents and doctors to encourage the prioritization of voluntary mental health care over involuntary mental health care, and hosted press conferences to educate community members and local decision makers on the need for alternative treatment options for those with mental illness experiencing homelessness. Now, we will hear from some of our LLEs about their experience with the Access program.
Hello, my name is Rosie.
My name is Thomas. We're from the Wellness Centers of San Joaquin County.
Over the past year, we have had the privilege of working with Access California, and our collaboration with Access has proven to be valuable.
The conferences and the webinars offered insightful content, while the retreat, the networking event, and the statewide conference facilitated crucial connections with like-minded individuals across the state, furthering our shared goals.
In addition to that, teaming up with other groups really helps our advocacy work. We get to swap tips, share resources, and learn new ways to advocate for what we need.
Plus, when we combine our knowledge and efforts, we can run much better campaigns, dig deeper into research, and reach more people. Basically, we're stronger together.
That's right, Thomas. Here at the Stockton Wellness Center, we have the Power and Support Team, which is a member-led initiative focused on developing advocacy skills.
And what's really exciting about that is that next month, we're proud to have this team host our very first Lunch and Learn, where they will share advocacy strategies with community members and CBOs and discuss how to join their efforts.
We would like to thank Access California.
And we look forward to another great year of networking with all of you.
Hi, my name is Jess Cianci, and I work at Mental Health Advocacy Services in Los Angeles. We provide legal aid to individuals with mental health disabilities within the county area. I recently also attended the Access Program's Forging the Future conference, which was a great opportunity for us to interact with our client population in a collaborative setting, and I really enjoyed the lived experience panel in particular. It was also really exciting to see the work that Access has been doing on AB 96, which should be a really promising and exciting bill for us. The Access program also supports our work with local LA judges and court administrators. We have a self-help clinic in partnership with the LA Mental Health Courthouse, and in 2024 we were able to serve around 100 litigants. But through that partnership, we also have the chance to host quarterly meetings with the judges and attorney offices and administrators of mental health court. These local meetings give us a chance to share the common questions and concerns of our clients with the court staff and to provide updates also about the local resources that are available to support indigent clients in Los Angeles. It's an important opportunity for us to provide insight and feedback about the court program and where it is failing to serve our clients and could do better, but it's also an opportunity for us to get updates about the changing procedures within the court system and how they impact our clients.
My name is Zoe, and I'm the founder and executive director of Communities Voices in San Diego. Working with Access was invigorating. The initial 3-day training set the stage for the work we collaborated on throughout the year. Being in a room with other peers, talking about the changes that were taking place as part of the behavioral health transformation process related to Prop 1 felt like finding my tribe. As peers, it is clear that our involvement in this process is crucial. I returned from this training with a renewed passion for my role in peer support. This process is so complex, and I'm grateful that the Access team is deciphering it and facilitating a way to ensure our voices are heard as these changes directly affect us. The Access team was incredible. They were always responsive, helpful, and had a contagious enthusiasm. The training provided valuable insights into the Prop 1 changes, which helped me better understand how to advocate for peer support in the County of San Diego. It's amazing how some things just fall into place. Before starting my collaborative work with Access, I had started attending the County of San Diego Behavioral Health Services meetings and various subcommittees and councils. I joined the San Diego Peer Council right before leaving for the training retreat. When I returned from the retreat, I started looking for more ways to get involved. I became more vocal at meetings, asking more questions and sharing information I was learning about during the Access meetings. I got involved with subcommittees, including a research and statistics group that organically grew out of the necessity to provide data about peer support being evidence-based. I've become more involved with the San Diego Peer Council and other County of San Diego behavioral health committees. And as part of the Peer Council, we drafted a letter to the BHS director asking for a seat at the table when voting on policies affecting peers. This is a significant step towards ensuring that peers' voices are heard in decisions directly impacting our lives. My experience with Access has inspired me to refocus communities' voices as an educational and support platform for peers, peer-run organizations, and those who work with and employ peers. We're developing a training and development hub centered on peer support and the 8 dimensions of wellness. We believe in the power of peer support, an evidence-based practice essential for recovery and wellness.
Access has a training and education component. And during this grant year, that's primarily been our LLE training retreat, the public quarterly trainings that we do on behalf of Access, and our annual statewide conference, which we held at the end of February. Access has provided extensive training and educational opportunities for our local level entities. Our LLEs represent intersections in the behavioral health community and do a variety of core work. Our LLEs include peer-run direct service providers, legal aid organizations, patient rights advocates, and community organizers who work at the intersections of poverty, behavioral health conditions, homelessness, and the criminal punishment system. Our organizations knew each other or knew of each other prior to collaborating on the Access grant, but the grant gave us an opportunity to get in the same room and teach each other about our areas of expertise and work and form those shared values and understandings that will advance the interests of the larger community. This exchange did start with a crash course in the past and present, the Mental Health Services Act, Medicaid, the social safety net, housing, laws and policies, and even current affairs. And while it was an intense couple of days, we all walked away much better equipped to serve the community than we did walking in the door. Access does publicly facing quarterly training webinars as well. This year's webinars focused on big picture issues. For instance, how the public behavioral health system is structured in California and how that drives law and policy. But Access also balanced the big picture trainings with more granular things of interest to the community, like how Medi-Cal works for mental health and SUD, when we're talking about Medi-Cal certified peer support specialists. Throughout all of the work that Access does, including its training and educational components, we stop and point out to stakeholders where the access points are and the pivot points are for them to make change in their local community. Our training and educational activities culminated this year in our annual statewide conference. Throughout the year, as we interfaced with our LLEs and the larger community, we listened, adapted, and responded to what the community wanted when it came to understanding behavioral health transformation in California and how they were likely to be affected. Often we heard that it would be helpful if we would give people the view from 60,000 feet on behavioral health transformation and how those various large pieces of the initiative were designed to fit together. This has been a major challenge as large pieces of behavioral health transformation policy were still coming online, particularly the BH Connect Medicaid waivers. We held the annual conference at the end of February. Looking around at the publicly available stakeholder information from other sources, we did not see what we wanted to present, so we created it, kept it simple as possible, and paired it with speakers of expert panelists who could drill down into the subparts and impacts. It was a success. 70% of our 250 conference attendees ranked our educational content as excellent.
And now let's take a look at outreach and engagement for year one. Between March 1st, 2024 and February 28th, 2025, the Access California team hosted 5 regional networking events, produced 12 podcasts, and 4 quarterly newsletters. In alignment with our contract training and education strategy plan, Access California hosted 5 networking events in the following regions: Central, Los Angeles, Southern, Bay Area, and Superior. Our target audience included local level entities, also known as LLEs, and Access ambassadors, clients, advocates, allies, and community members, peers and peer-run agencies, professionals and providers, and behavioral health leaders. These regional events included the option to attend the community empowerment or leadership workshops based on the participants' personal preference and role, and a listening session facilitated by the Cal Voices Health Equity and Access to Behavioral Health Recovery Services, also known as Hear Us. The workshops were designed to increase skills and knowledge to meet the needs of diverse and rural communities by outlining skills to tailor advocacy messages to deliver effective public statements from meetings and hearings, reviewing the Behavioral Health Services Act and local community program planning, and reviewing the core principles of shared decision-making. The listening session was designed to introduce the Hear Us roadmap and how its components inform actionable strategies to support and overcome barriers to meet the needs of diverse and rural communities. In total, 170 participants attended our 5 regional networking events and shared the following. Participants appreciated being able to connect with one another, and participants valued the event content and wanted more. Lessons as we've already started planning for year 2 include rebranding with a name change. Although networking events may sound inviting to some, we found that the name didn't quite capture what the events were truly about and may have inadvertently turned people away from registering to attend. And marketing, including renaming the events to create a welcoming and robust learning environment. We will plan each event with more notice to increase time, to do some targeted marketing and increase overall attendance. In the first slide, you see the outcome of one of the group activities facilitated during one of our regional networking events, which took place in fall of 2024. The flip chart includes a list of barriers to accessing behavioral health recovery services when working in diverse and rural communities that one of the groups of peers, CHWs, and local behavioral health leaders identified. In the next 3 pictures, you will see images taken from our podcasts we produced throughout the year. To educate and inform client stakeholders and policymakers to lead the way and address the impact of statewide policy issues, Access California produced 12 podcasts in the last year. The podcast features persons with lived experience and lived expertise discussing the contemporary issues facing the community as well as guest speakers. Some highlights include the peer workforce and challenges in establishing ourselves as recognized and uniquely competent behavioral health providers, the true history of deinstitutionalization, defunding of our public behavioral health systems and social safety net, and the intersection of these issues with current affairs across the country. Lessons learned as we go into year 2 include that podcasts, visual aid, and recorded videos are more accessible media for some members of our community, and that complex issues can be represented and understood in conversation and discussion. In our last 3 pictures of this section, you will see images taken from our quarterly newsletters and announcements we produce throughout the year. In year 1, Access California expanded our quarterly newsletter reach to 10,350 clients, advocates, allies, and community members, peers and peer-run agencies, professionals and providers, and state and local behavioral health leaders. This amounts to a 20% increase. Our subscribed readers receive the following updates from the Access California quarterly newsletters, including legislation and policy updates, program highlights, and upcoming activities and events. In addition to our quarterly newsletters, we send a condensed quarterly announcement to remind those on our email list of significant dates and upcoming trainings. Lessons we've learned along the way include, although we've increased our subscribers, utilization rates are low. To increase engagement among our subscribers in year 2, we plan to highlight our LLEs and their quarterly success stories. We're excited for year 2, and we'll keep growing and adapting in response to our community's needs for true inclusion within our outreach and engagement strategies.
Conclusion. In this section, we will talk about key takeaways from year 1, year 2 themes and objectives, upcoming Access activities, and how you can stay in contact with Access California. General takeaways from contract year 1. Clients are unsure how to navigate the changing public behavioral health landscape and are looking to Access California to provide leadership in this area. Clients want accurate and timely information to help shape their advocacy strategies. They want to know what is happening at the state level and how it is being implemented locally. Clients want to know the most effective ways to advocate for their own needs and the needs of their communities. They want to maintain and expand non-clinical, consumer-operated, and peer-run services. They want expanded employment opportunities for consumers. Clients want their counties to have maximum flexibility in Proposition 1 implementation to preserve local control and respond to the unique needs of their communities. And finally, clients are worried about the impacts of changing federal policies and funding priorities that will impact the public behavioral health system and the services they receive. Year 1 takeaways regarding the needs of rural and diverse communities. During the listening sessions at our 5 regional networking events this year, participants shared the following barriers to recovery-oriented services for rural and diverse communities. 1, lack of resources, either knowing what resources are available for rural and diverse community members, or resources aren't easily accessible in rural areas. 2, language. Individuals experience a lack of accessible services in a variety of languages or cross-cultural approaches to services. 3, immigration status. Undocumented community members are often hesitant to access services. And finally, 4, childcare, insurance, and other costs associated with recovery services are also identified as barriers to service. Some strategies to overcome these barriers that listening session participants shared include 1, diversity and equity trainings to increase knowledge among service providers. 2, mobile vans like shower trucks equipped with referrals to intervention and prevention services. 3, assistance with system navigation, both in-person and virtual. 4, providing transportation services or bus passes to get community members to and from recovery services. And finally, 5, providing translation services and hiring staff who mirror community members being served. Access California will focus on the following themes and objectives in contract year 2, 2025 to 2026. 1, ongoing Proposition 1 implementation at the state and local levels. We will continue to monitor rules, policies, regulations, and guidelines and their impacts to clients locally. 2, conducting training and education around the community program planning process. Access will identify model community program planning process practices and standards for community collaboration and engagement. 3, the shifting availability and accessibility of voluntary public behavioral health services. Access will focus on assisting clients and communities in navigating behavioral health services provided through Medi-Cal managed care plans rather than county-based systems. And finally, 4, preservation and expansion of consumer-operated services and peer support by providing consumer-provider models of service delivery, such as deconstructed clinical services, and expansion of peers into Medi-Cal managed care plan services, for example, working in roles such as community health worker. Upcoming Access California activities for contract years 2 and 3. Throughout each contract year, Access California conducts the following activities: 4 quarterly newsletters, 4 quarterly training webinars, 4 quarterly policy webinars, 12 monthly podcasts, 5 regional training events, and 1 annual conference. All of our webinars and podcast episodes are recorded and available on Cal Voice's YouTube page. Stay in touch with Access California online, by email, by phone, and watch the recordings of past webinars and podcast episodes on Cal Voices YouTube channel. You can reach us at www.calvoices.org/access. You can email us at access@calvoices.org. You can call us at 916-573-0522, and you can watch us at www.youtube.com/@calvoices.